Williston parents for being here. I recognize that this is taking time out of your evening to be here, and hopefully this presentation will be really informative for you tonight. So as Mr. O'Brien mentioned, if you have any questions throughout the presentation, feel free to interject, type it in the chat, raise your hand. Additionally, I would be happy to provide all of you with my email if you don't have it already, as well as my direct line to the office. We at Wheatley and East Williston as a whole really try to support our students as well as their families in the best way that we can. So please never hesitate to reach out to any one of us if you have any questions or concerns. So today we're going to be talking about substance use and mental health among youth, not just adolescents, really the trends that we're seeing regardless of the age. One thing that substance use does not do is it does not discriminate. It affects people of all races, genders, ages, and socioeconomic statuses. So again, hopefully you'll get some valuable information tonight. Just a quick background about myself so that you can get to know me a little bit better. My name is Navarra. I'm a licensed social worker. I've been in the field of addiction and mental health for about 7 years now. And I've had a wide variety of roles in my time as a practicing social worker. So I've been working in a mental health and substance use clinic since I started my practice. I've also spent 2 years in prevention and education, where I delivered a lot of various substance use and mental health programs to over 100 districts across Nassau and Suffolk, grades K through 12. Really developmentally appropriate but relevant information so that kids have the tools to make the best decisions possible for themselves. And currently, at my amazing role at Wheatley, I work alongside the amazing Dawn Muscanera and the rest of the Wheatley guidance team, again, to just support students with any day-to-day emotional or academic need that they might have. So our roles vary from crisis counseling to group therapy, individual counseling, as well as some class push-ins to be able to further the conversation with our students. So just a little background about myself. We can just dive into it tonight. So these statistics come from the National Institute on Drug Abuse and the National Institute on Health, two really big governmental organizations that do significant studies every few years. There's a specific study that the National Institute on Drug Abuse conducts called Monitoring the Future. And these are surveys that students in middle and high schools receive. So this is not coming from the mouths and the hands of parents, from clinicians, from teachers, and other support staff at schools, right? This information is coming directly from the kids themselves. So you know if it's an anonymous survey, and most kids really don't hold back. So it really informs the level of care that we should be providing in terms of prevention and intervention-based services. But it also gives us good insight as far as the trends among youth today. So as a whole, definitely seeing an uptick in calls for crisis counseling. So this includes the Long Island Crisis Hotline, as well as the Long Island Council on Alcoholism and Drug Dependence, their substance abuse 24-hour hotline. To get a little bit more specific, the calls during COVID that they've seen an uptick in are for alcohol and pharmaceutical medications, mostly opioids, so any type of prescribed pain medication. But that's not to say that we're definitely seeing increased rates in other substance use as well. So overall, the vaping rates, and vaping has been a really pressing thing, a topic of conversation over the last 2 or 3 years, I would say in particular. So just a couple of statistics that I provided for you. These are straight from the Monitoring the Future survey that I mentioned earlier. And although we are seeing vaping rates start to plateau a little bit, it's definitely something that's still of concern. And I have to say, Wheatley students are really amazing, the kids that I work with. And something I really admire about them is that they're really honest and upfront as far as what's going on for them, and as far as the trends that they're seeing among their peers with respect to substance use. So I've spoken with a lot of kids recently about the vaping epidemic, as we can call it. And it seems, at least in Wheatley, And not to overgeneralize, but the vaping trend has kind of gone down a little bit. What I've been hearing across the board is that the vaping hype has kind of ceased, not completely ceased to exist, but it's definitely not as prevalent from what we're seeing within the school. And, to me, that's a positive thing on multiple levels, right? That kids are being more mindful of their decision making and taking care of their health. But as it relates to COVID, right, they're also taking that idea of a personal bubble and having that space and not making decisions to compromise our physical health. They're taking it very seriously. So I think that's a really positive thing, a really good thing as far as substance use headed towards the right direction. Marijuana use as a whole, the rates have remained steady, and this is with respect to vaping or using marijuana in all various types. So it can be the flower bud that many of us are used to seeing or hearing about. This is also a vaporized form of marijuana. So it can be in the form of a liquid or an oil base that students or adolescents smoke. Also marijuana edible. So anything that the marijuana is cooked in, right? So marijuana still remains steady, and we still have to keep this as an issue of concern potentially in terms of how it relates to use, misuse, and abuse of substances.
About substance stuff.
I'm sorry, do we have a question? Okay. Just checking. Please, parents, by all means, I really want to hear from you. I want to be able to help support you and your family and help to reinforce and continue that conversation with your kids. So by all means, don't hold back. So we'll just go back to the trends really quickly. Definitely, we're seeing an increase in stimulant and inhalant use specifically among 8th graders. Another just statistic that I've gotten from that Monitoring the Future survey. And if you'd like to see that specific survey in terms of the demographic of students that completed the survey or how many people were involved, it's across every state, many districts, definitely reduced. This year was a little bit reduced in the amount of surveys they've received because of COVID, but it still is really knowledgeable information. So if you'd like a link to that survey, I'd be happy to provide that for you as well. One thing I want to mention, which we will get into in the next slide, is, and this is a quote from Newsday, the article was published, I believe, January 21st of this year, that on Long Island specifically, we are seeing alarming amounts, right? Quote straight from Newsday, of fentanyl and methamphetamine on Long Island. And to give you an idea of the potency or what fentanyl is, right? It is an opioid, just like heroin, just like oxycodone, Percocet, Vicodin. Doesn't matter if it's something that a dealer would make in his basement or something that you would get from a reliable doctor. It is the most potent opiate that we have on the planet. It's about 50 to 100 times stronger than heroin and morphine, which we could consider, aside from fentanyl, for all intents and purposes, pretty strong opiates. So if you look to this picture right here of this penny and this white powder next to the penny, that is a lethal dose of fentanyl. Very, very small amount. And this substance is so powerful that if you are in enough if enough fentanyl is in your presence, if you breathe it in, if you get it on your skin, right, it's very porous. That is enough for somebody to experience the side effects of being under the influence of opioids. So what we're seeing, not just on Long Island, definitely, as I mentioned, a large presence of fentanyl on the island, but this is countrywide across every state. If you Google fentanyl overdoses or fentanyl-laced substances, you will get a myriad of articles, tons and tons of information of people who sadly have overdosed and lost their lives as a result of this. So what we're seeing is street level dealers buying fentanyl, maybe sometimes opiates as well, but it could be really any combination, any powder and potion that a dealer could get their hands on. And they have what's called a pill press. So maybe a terrible analogy, but the way I compare it to is, I don't know if you ever purchased this for your kids, or maybe if you had a fun childhood, but there are like these Play-Doh machines that kids play with, where you put the Play-Doh in and it kind of gives you a star or a rainbow or a moon, right? Fun things like that. But I just compare it to the pill press because the pill press works in a similar way. So you buy this machine on eBay or another black market type of website for a few $1,000s. A dealer combines any type of pill, potion that they want in this pill press, and they can buy the actual markings of the designer substance for that pill press. So if I could advise you to just take a look at this picture of the Xanax, for example, the Xanax on the left is a counterfeit Xanax. It has been pressed versus the Xanax on the right, which is a pharmaceutical grade designer substance, right? And if we look pretty closely, we can see that the counterfeit Xanax might be a little off. So the ridges to separate the doses of the Xanax bar are not exact, right? There might be a little extra on the edges, as you can see. But if we consider, let's say, an adolescent who's struggling with depression, or who has a really severe addiction that has consumed their lives, right? They're not necessarily going to examine the pill or even maybe take it a step further and buy a drug testing kit to make sure that this substance is legitimate. So time and time again, and I can attest to this with my working with patients on the outside, I've heard this happening way too many times. Not my client personally, but we just had a loss about 2 weeks ago of this happening, not too far from us, where somebody purchased, it was actually an oxycodone. So this pill right here, this 30 milligram pill, again, the user, for all intents and purposes, thought it was an oxycodone like he's gotten time and time again before. And it was almost pure fentanyl. So unfortunately, that young boy is no longer with us today. So again, I provide this presentation for seniors in their social studies classes. I've begun to do that. So we talk about college, we talk about the college experience, and really being able to make healthy decisions with regard to substance use. And I think it's really important to deliver this information to them so that, again, it goes back to knowing what's healthy for myself and knowing what's unhealthy for myself. And so many people are shocked to hear that something like this is out there. I had a really great conversation with some of the students, and they asked me, why do people do this? Right? Why would people want to harm their clients? Why would people want to kill somebody with such a potent substance? And we have to remember, or have to try to place ourselves, as maybe difficult as it is, in the minds of a dealer, right? They want to provide the best product so that their customers keep coming back for more, right? I had another incident about a year ago where it was two friends. One of them unfortunately lost his life due to a fentanyl-related drug overdose. And his friend is sitting at his friend's wake, and he wanted to get the same drug that his friend who had just passed had gotten, right? He wanted to be anesthetized so much to the point of almost dying, right? So we're going to get into that conversation later as to why, right? I'm sure some people are hearing this and thinking, oh my God, that's absolutely crazy. Why would anybody want to do something like this? And one of the points that I really want to hit home is that nobody chooses to use drugs to become addicted. And nobody starts using substances and thinks, I'm going to become addicted, right? It happens so naturally and so quickly. And at the end of the day, there's always a reason, even if it doesn't make sense to us, and even if we can't necessarily identify that reason, as to why people are seeking out substances, right? Why they're using some of the most potent substances on the planet to self-soothe, right? To self-medicate. So I just want to go back to parents. Any questions so far or comments? From our Wheatley staff, any questions or comments? I welcome input from you as well. Okay. So we're definitely seeing how COVID, mental health, and substance use kind of all impact one another. And I think we can kind of recognize our own experiences with how we've been able to handle or cope with COVID, or maybe not so much cope with COVID, as far as what's been going on for almost a year. And it's pretty crazy, if you don't mind me saying, that it has been almost a year of COVID, but definitely reduced social interaction, right? Kids are not hanging out with their friends like they used to. And this is at a time and a developmental level where kids look to their peers for meaning, right? To find connection, to find support, right? So we have to remember that too, like the impact of all of this is having, not only on our children, right, but on ourselves as well. It would be silly, in my opinion, if you don't mind me saying, to think about COVID, and even though it's been going on for a year, to kind of discredit our feelings with respect to this, right? And to think that this is not still very much a delayed trauma response to what's happening, right? And I say trauma, and that's definitely not a dramatized word for what's going on. I work with a lot of clients with significant trauma in my practice, and how COVID has been, in a way, kicking up a lot of different things for them related to helplessness and powerlessness, right? At the root of trauma, that's really what comes up for a lot of people, right? Having no control over my own life, having my whole day so regimented and so dictated, having no reprieve from all of the stress that I've been experiencing, right? So we're definitely seeing increased rates, as I mentioned, calls to the hotline, but also increasing rates of children and adolescents trying to receive counseling services, which is so important, right? And I'm not putting that down by any means, but definitely increased rates in things like depression, right? Anxiety and panic-related disorders, even things like eating disorders, right? Because it's not the end-all be-all, but it very much relates to, I am feeling out of control. I have no control over my life or in my life right now. So I need to find some semblance of that, right? Even if it might be perceived on the outside to be an unhealthy way of managing my life, or an unhealthy way of kind of reinforcing that control. It's definitely still a valid thing that a lot of people are experiencing. So when we think about addiction and substance use and the brain, I know it says the teen brain, but we can think about neurological development as a whole, right? Our frontal lobe, I like to think about it as the brake in our car. So this brake doesn't develop until our mid-20s. So if we're considering an adolescent boy or girl, for example, 14 years old, they still have over a decade of brain development. And even more if we consider elementary or middle school aged youth. And what we've seen from PET scans, right, MRIs, and really being able to dive in and legitimize this with science. Studies consistently show time and time again that the earlier children and adolescents start using substances, the greater the likelihood of them developing a significant substance use disorder as they age. So I just put one statistic at the bottom for you here with respect to drinking. Because I would say alcohol and marijuana are the most commonly used substances among youth, especially adolescents. But this is across the board for all substances. And again, something that I want to mention is drinking and even marijuana use are very normalized in society. And I'm not here to say that substance use, drinking, marijuana use is good. I'm not here to say it's bad, just in the context of what it can do, right? Playing the tape, as we say, a little bit further and considering the long-term consequences of doing something like this, right? Or engaging in this particular behavior. And, you know, if we have that normalized perception as a child or as an adolescent that it's okay to manage whatever is going on in my life with drugs and alcohol, chances are that core belief, right, is going to not go away as we age. It's going to be more ingrained and more reinforced within us. So, I just put it out there to parents. I encourage you to reflect and to consider how you approach the topic of conversation with your children. I should have prefaced that by saying I am not giving parenting advice. I'm not a parent, and it's definitely not my place. I definitely think being a parent is one of the most difficult jobs that you can take on for yourself in this lifetime. So kudos to you parents for being here today. And that's including the Wheatley and East Williston staff that we have here tonight. But like I said, I just encourage you to consider or to reflect on how you phrase the conversation with your children if you do, right? And we'll get into risk factors later on, but a passive attitude towards substance use is absolutely a risk factor for impulsivity or impulsive behavior related to substance use and abuse. And again, to me, it's not necessarily about using versus not using. Yes, that's an important thing to consider, but more so recognizing what is the purpose of my behavior, right? That could be across the board, not just related to substance use, but for the purpose of today, right? What am I getting out of taking this drug or taking this drink? What is going on for me before I get those urges or before I'm triggered, right? And what's going on for me during the use? Just as important, what's going on for me after the use, right? And I say that to help our kids connect the dots, right? I have a client that I'm working with. He is a 16-year-old boy. He smokes quite a lot of marijuana, but he also is diagnosed with anxiety and panic disorders, which I recognize is a very real and valid and debilitating thing to have to experience on a weekly basis. So, of course, I'm treating him for the substance use and the mental health. And I have to recognize that I might not agree with him smoking marijuana all day, but I have to help him to recognize both sides of the coin. And I have to see in my clinical perspective what this is doing for him. So we had a good conversation the other day about his anxiety. So he, uses marijuana to self-medicate, which is, again, a very common reason why people get into using substances in the first place. So I asked him on a scale of 1 to 10, right? 10 being the least amount of anxiety you've ever experienced, 10 being the most anxious you've ever felt in your life. When it comes on for you, what is the feeling? He said it's about usually an 8 or 9 typically, depending on the day or depending on the situation. Okay, so that leads you into smoking. We can recognize that. When you smoke or after you've smoked, where is your anxiety? It's about a 6. Okay, so it went down a couple of notches, but not tremendously, right? Which he was able to recognize as well. Okay, so you're feeling slightly better from the marijuana. It takes you out of yourself for a little while. Then when you come down from the marijuana, right, when you're feeling a little burnt out and you're looking to smoke again, what is your anxiety level? Oh, it's usually a 10 or an 11. It's really intense for me because I'm not numb anymore, and all of my feelings and it's like all of my life experiences just hit me at once and I get so overwhelmed. And I share that with you because by going through this sequence of events with him, he was actually able to acknowledge that the weed served that purpose as far as instant gratification. But in the long term, right, it didn't actually help him. It wound up hindering him, not just with respect to anxiety, but with various life areas that he's struggling with right now. So just some food for thought there. It could be a great way to kind of approach the conversation if we can come from a place of genuine compassion, empathy, and understanding, as opposed to coming from a place maybe of judgment or a place of punishment. Any questions so far, parents? Okay, moving on. So I just want to spend a few moments going over the progression of substance use. And I kind of talked a little bit about this earlier, just in the sense that nobody decides that they're going to use drugs and become addicted. It's a very natural progression that happens. And I would say about 100% of my clients have said something at one point or another along the lines of, if I knew the path that I was on, if I knew and if I could recognize that I was becoming addicted to these substances, I would have stopped a long time ago, or I would have tried to get help a long time ago. So it's something that happens, again, so quickly. It truly is at the blink of an eye. Although something like this could be going on for months or years, when we're in that behavior, or when we're in what I call that survival mode, right, where we're not really able to be engaged in our day, we're just focusing on getting well for that day, we really can't see our situation clearly, because the substance is totally guarding our perception of reality and what's going on in our life at that point. So research shows it's about 50%. About 50% of people can use substances recreationally or socially, and they might not have much of an issue, whereas the other approximately 50% of people will use, misuse, abuse, and subsequently become dependent. And when we think of dependence of a substance, depending on what substance or substances that we are using, we have a physical dependence, meaning if we do not have the drug, we become severely physically ill. So we see this often with alcohol and opiates in particular. Xanax as well, when we think about the withdrawal symptoms, you could kind of consider it similar to like a delirium tremens, where we're having episodes of shaking or even potentially seizures. But with opiates, right, I would say from what I've heard from clients, it's the most pain you could ever feel in your life. It is like the flu, or now we could probably compare it to something like COVID times a million. And I share that important fact because it's not, I need to get high at that point for somebody who is at this require end or at the end of dependence as to the reasons why their use is perpetuated. It's more so, I wake up and I cannot move. I'm in the fetal position on the floor of my bathroom, and I need to get well so that I can go to work and not feel this intense pain. Right. So that's why I described it's very much a survival mode. It's just getting through. I need to do what I have to do at this point in my life to be able to survive. So it's not even living, sadly. So that's kind of one description of physical dependence, where we would definitely need some type of medical related detox if our use becomes escalated to the point of feeling a physical withdrawal if we don't have the substance. And I would say more commonly, and this is across the board, no matter what substance we're really considering, is that mental or that psychological dependence. And that comes with intense craving. So quite literally being taken out of our day, taken out of whatever we're doing, and our brain is so one-track minded, it's quite literally obsessed, right, with getting the substance. So we might have thoughts related to when we're going to use, who we're going to be with, what behaviors we have to engage in to get the money to be able to get these drugs. So physical and psychological dependence, both important factors to think about when we consider this progression. But I've listed some key life areas for you, and I'm just going to touch upon them very quickly in terms of how to recognize the signs and symptoms within somebody that you care about or you love. So we consider health, whether it be physical or psychological health, any decline or deterioration in somebody's health and well-being. So with respect to physical health, this can look like somebody's physically appearance changing. So maybe they've gained a lot of weight or they've lost a lot of weight in a very short span of time that cannot be attributed to any physical health condition. This can look like we see skin picking, for example, with people who are using opiates and methamphetamine or stimulants, right? Where somebody is kind of obsessively picking at their skin. It doesn't necessarily have to be their face. It could be any part of the body, but unexplained cuts or markings that, again, are not attributed to falling or getting an injury. When we consider decline in mental health, right? Changes in your kid's mood, in their affect, changes in how they perceive things at home and at school. And again, I know this can be hard to recognize because if we can consider the developmental changes that occur during puberty and adolescence, moodiness is very normal, right? So I don't want you to go home and see your kid, slamming doors and getting mad at you and saying, oh, he's definitely or she's definitely on drugs. Definitely not what I'm saying, but focusing on changes that are outside of the norm for your child. Right? Every kid, and even every adult for that matter, is going to have their moments, where they're not happy. But you could consider these to be taken to the extreme. So would anybody like to ask questions or need any clarification so far? Okay. When we think about family and friends or engaging with our peer group, definitely if we see more isolating behavior, more keeping to ourselves, staying in our room, not doing normal day-to-day routines. So if there's a norm in your house that everybody comes down at 5 o'clock and watches a show and eats dinner together, and you're noticing more times than not that your son or daughter is up in their room and they're avoiding those family interactions, again, could possibly be an indication of some substance use going on. Like I said, I'm definitely not saying that it's a cause and effect relationship, but along the lines of mental health too, it could be an indicator that, your child is having or experiencing a mental health challenge that maybe they don't feel comfortable talking about, right? Or maybe they recognize that something is wrong within themselves, but they don't really know how to articulate that or how to start that conversation. So when we think of the financial aspect, any change in financial situation. So for example, if you give your child $50 for lunch on Monday, and that's supposed to last them until Friday, right? And by Tuesday, all of the money is gone. Where is the money going? I doubt they're spending $50 at the Wheatley cafeteria unless they're buying lunch for all of 6th period, for example. Or we could see the opposite. Right? Same analogy. You give your child $50 on Monday for lunch for the week, and you check their backpack and they have $200, right? Kind of question along the lines of where is this money coming from? And that could potentially be an indication that maybe they could be selling substances. We talked a little bit about craving, right? Those obsessive thoughts that are just recycled and constant, and they relate to compulsive behaviors, which in this case would be using substances. School and work, any decline or deterioration in your child's ability to succeed academically or occupationally if they do have a job. So if you're used to your child getting straight A's and this is the norm for them, all of a sudden, their Q2 report card comes back, you're seeing mostly C's and D's, definitely an important warning sign to not overlook. And again, like I said, it's important to try to not be accusatory, right? There could be other underlying issues that are happening here, but we really don't know until we ask the right questions. Legal is a life area. So when we think about how the diagnostic criteria, for assessing somebody for a substance use disorder, legal was in the old DSM, the Diagnostic and Statistical Manual for Mental Disorders. They have since removed that from the new version because they recognize that everybody doesn't get into legal trouble. And, the reason why I bring up the DSM and diagnostic criteria is to just make a point that even one life area of impact, I could clinically diagnose somebody with a mild substance use disorder, right? And that will relate to certain treatment interventions that they would be eligible for receiving. And again, I mention that because if we see a change in one of these life areas, really important as much as possible that we address this early on. It's never a good idea to wait until our life is turned upside down and we've hit rock bottom to get somebody help. Because at that point, there are probably a lot more issues arising here rather than just the substance use. So again, the key is early intervention, right? The earlier we can tackle and identify somebody that's struggling with a substance use or mental health disorder, the better the outcome, time and time again. I like to think about the iceberg analogy when I talk about substances, especially with whether it be clients or family members, because I feel like it's a really good analogy for what we see, but most importantly, what we don't see. So on the surface, we might see substance use, right? We might see really erratic behavior. We might see a problem child, and we're kind of trying to wrap our brains around why this child is acting the way that they're acting, right? Why my child, who has been a straight A student, who has never had a problem at school or at home for that matter, is exhibiting such polar opposite behaviors, right? That's just what we see on the surface. And 100% of the time, I am confident when I say that there's always something underlying the substance use. It's never just that. Even if it's just, I want to experiment, I want to try it out. That's still a reason. Might not be a valid reason in, your minds as parents, but again, opening up the conversation to gauge a good understanding of what is going on with our children and where their mindset is at. What is relating them to, or what is tempting them to seek out substances? So, like I said, we see substance use at the tip of the iceberg. And as you can see, the following concerns, conditions, behaviors, experiences that some of our youth could be experiencing at this time, right? Especially going back to the idea of trauma and with COVID, right? Any trauma that we may or may not have experienced is basically magnified related to COVID. I could spend a whole hour sharing client anecdotes of clients who I've worked with, as I mentioned, who have significant trauma, that this is just a perfect storm. Right? So many of these themes, which we talked about earlier, of lack of control, of powerlessness, of helplessness, right? It could be definitely re-triggering to a person. And when we think of trauma, sometimes it could be things that we might not consider to be trauma, right? Like a divorce, an absent parent. And by no means, parents, am I putting you on the spot or being accusatory by any means. These could be things that might have happened outside of our household. But like I said, it's important when we explore this with our kids, like I said, being able to open up the conversation with them so that they feel that you are holding space for them in a non-judgmental way to be able to talk about these things. Because substance use, mental health, right? Anything that we are experiencing, to be able to share with another person, right? Even if you are a mom or a dad, it's still a very vulnerable experience to be able to put ourselves out there, right? So the more you can meet your child with understanding and with compassion and with respect, that's going to reinforce them to be able to feel comfortable to come to you in the future with other things that are happening. So again, just some food for thought there, just some friendly suggestions for you. Just some stats on mental health. I'm not going to bore you with the statistics, but it is a very common experience, right? And we have to really normalize the conversation about mental health and wellness. We've done a really good job as a society, I would say, destigmatizing mental health. We need to work a little bit harder with mental health and with substance use. But saying that I have depression, or I'm struggling with anxiety, or I'm having problems with my body, right? My body image, that doesn't make somebody a weak person. If anything, from my perspective, it makes them really emotionally intelligent and very self-aware, that they can recognize what is going on for them internally and for their system and feel comfortable enough, as, again, uncomfortable or as anxiety provoking as that can be, to be vulnerable with another person, to be able to reach out for help. So, to me, the mental health piece, it is considering people who have legitimate diagnosed mental health concerns, but it doesn't necessarily have to be, right? Just like we take care and manage our physical health, our mental health has to be just as much as a priority. So again, just normalizing that conversation with your kids, helping them to recognize these signs and symptoms. And, I have to say, Mrs. Muscanair and I have been doing some class push-ins in some of the health classes and the gym classes. And I commend our health teachers and the rest of our faculty for really being able to incorporate mental health, addiction, substance use, among other things, into the curriculum, right? Really doing a great job at tending to social and emotional learning. And that's really what it's about. It's about normalizing this conversation and normalizing it at home as well as at school. So I know I touched upon a few of these earlier, but just some risk factors to consider. I know we talked about the parental attitudes, right? Or taking kind of a passive stance on substance use. I don't have the exact statistic, but MAD, Mothers Against Drunk Driving, posted a really informative article about a year ago and was gauging teen attitudes towards drinking and towards marijuana use. And it was a very high number. I want to say it was approximately 70% or 75% of students reported that if their parents had a strict attitude towards drugs and alcohol, right, and they kind of set firm consequences and firm boundaries around substance use, that kids would respect it. And, I think that speaks for itself, because kids, like I said, they don't hold back. They very much speak their minds a lot of times. So I think that is kind of indicative of what we need to do as, school supports for our kids, but also as parents. We talked a little bit about the early use earlier on in the program. But again, if we can delay substance use as much as possible to age 25, that will dramatically reduce the chance of somebody experiencing or having a substance use disorder. And again, at the end of the day, those underlying mental health concerns, because like we talked about with the iceberg analogy, there's always a reason. Maybe we aren't aware of the reason, or maybe we don't want to know the reason, but there is always a reason why people, not just kids, but adults as well, turn to substance use. And some friendly suggestions for parents. Again, just some friendly advice. No, not forced parenting advice, but just something that I've seen in my practice help tremendously for families. Because as we know, addiction is not just an individual disease, it really is a family disease. So we need to recognize our family dynamic and kind of how that plays a role in reinforcing certain behaviors, but also enabling other behaviors. So as I've said numerous times throughout this training, I really encourage you to normalize the conversation with your children and engage in these conversations regularly. Right? The more we do that, the more we talk about these things over dinner, just like we would talk about the Super Bowl game, right? And how we're so mad that Tom Brady won yet another Super Bowl. If we make these conversations regular, right, and make it just like any other conversation, I promise you your kids will feel more comfortable talking about these issues, and they won't be afraid to stand up for themselves. So, I encourage you to role play with your kids, help to teach them assertiveness skills and what it means to make a healthy decision and how we really get to that healthy decision. Talking to them about their goals and about their future, right? And again, how that relates to our decision making. and really reinforcing that idea of consequential thinking. So playing the tape far beyond this one moment of instant gratification, and how my decision, regardless if it relates to substance use or not, how that decision will impact me today, tomorrow, a week from now, and maybe even a year from now. So we definitely have these supports within our guidance department at Wheatley and Willits Road, as well as Northside, to making it a regular point to reinforce these skills with our students as well. So another important point is being able to set clear expectations and boundaries that you can commit to. And this is so important, right? Being able to set consequences for certain behaviors and communicating that clearly and explicitly to your kids. So it's never a good idea to commit to something in the moment that we can't follow through on, because the message that it sends to our children is conflicting, right? In one sense, we hear, if I go out and get drunk or smoke and come home high, I'm going to be grounded and I'm going to lose my phone privileges. But then when I do those behaviors and then I come home and mom's fine with it, what does that show me, right? It shows me that I know what I can and cannot do to get away with certain things. And I'm not faulting the kids, right? We could potentially see this as manipulative behavior, but again, it's just kids learning from their experiences, right? Very much learned behavior. And again, we can reinforce both positive and negative consequences with our children, but it's so important that we remain consistent on those consequences. So setting firm boundaries, setting clear expectations, as well as what happens when we break those expectations. Something that I think is a really great idea too, just a suggestion, is having a code word for your kids. So I had one parent of a client that I'm seeing recently, and it's been really successful for him because, he has social anxiety and he doesn't have the best self-esteem. So it's very much easier for him to give in to peer pressure, which I know it's definitely not just this one client. I hear time and time again from our students that I don't feel comfortable speaking up for myself. And again, this could be related to a multitude of things. It could be related to our self-esteem. It could be related to not wanting to upset somebody, right? I don't want to speak up for myself because I don't want my friends to take this the wrong way. So having a code word or phrase is so great because it makes your child feel like they don't have to single themselves out when they're in a situation involving peer pressure that they don't want to be in. Right? And it avoids them being in a situation where they could be potentially taken advantage of. So it could be as simple as pizza, right? Your child texts you pizza or sends you a cute little pizza emoji. You know, okay, my child is in trouble. Say no more. I'm coming to pick you up, right? Maybe you have a phrase that you share with each other over the phone. Because again, we have to try as much as possible to put ourselves in the minds and bodies of an adolescent. As anxiety provoking, or as much as we would not want to do that and go back to those times, we really need to do that to be able to understand what they're going through. And again, like we talked about earlier, peer support and peer validation and connection is more important than anything right now. So of course it's normal to recognize that kids might not want to say, hey, I don't really want to take that drink, for fear of what their friends or what their peers might think. So again, having that code word or code phrase is so powerful. And along the lines of what I was saying earlier, again, maybe trying some role plays out with your kids about how to navigate peer pressure or how to be assertive, right? How to advocate for ourselves, or how to remove ourselves from situations that, like I said, we could potentially be taken advantage of, or we could potentially not make the best decisions for ourselves. And just some resources on where to get help. We have the amazing Wheatley faculty and East Williston faculty, and I mean that in the most sincere way. I've worked with a lot of districts, and there are not as many dedicated professionals like we have in East Williston. It's a really amazing school district. So please do not hesitate at any point to reach out to myself or to the other amazing guidance and administration that we have. I've also included resources for LICAD, so the Long Island Council on Alcoholism and Drug Dependence. Both numbers, you can access their 24-hour hotline. So if someone is in the middle of the night feeling triggered or in crisis, there's always a licensed clinician at the other end of the line. And LICAD has the most amazing, compassionate staff. Really, really great agency to provide a lot of services for people. So in addition to operating their 24-hour hotline, they also provide very much reduced or even free counseling, as well as referrals to treatment. So when we consider treatment, even just finding a therapist for ourselves, we can be so overwhelmed by the waiting lists and people not returning our phone calls to the point where it becomes very frustrating and we almost want to give up. But LICAD is great because they do all of the back end work for you. So you can give them a call, let them know what you're struggling with, and all of their resources are very much vetted, and they take that very seriously. So LICAD is a great resource for counseling, crisis hotline, and referrals to treatment. There's also the Long Island Crisis Center, which also operates a 24-hour hotline with trained volunteered professionals. So not all of them are clinicians, but they very much go through an extensive training process to be a trained crisis counselor. There is the NAMI, the National Alliance on Mental Illness, who also has a hotline, and they provide wonderful support groups throughout the community. And last but not least is the 24-hour mental health hotline of Nassau County. So they do similar work as LICAD does in terms of connecting people to treatment based on your insurance or any financial constraints that you may have. So I just want to turn it over to the parents with our last few minutes of the training. Any questions or any comments? Okay, thank you, Dr. Feeney. Absolutely. Kudos to Tom Brady on yet another win. So parents, I will just type my email in the chat for you, as well as my direct extension. I am at school Mondays, Wednesdays, Thursdays, and Fridays. If I'm not available, the lovely Mrs. Muscanera or anybody else on our wonderful guidance team can definitely support you. But as mentioned, and I genuinely mean this, please do not hesitate if there's any question or concern, even if it's a personal thing. You know, I recognize that these topics are, like I've said, very vulnerable to talk about. So just know that you have a safe space with all of the people that are in the training with you here today.
Well, Ms. Navarra, I'd certainly like to thank you for your time and this information. As the parent of a high schooler myself, it's definitely information that we as parents can utilize to make sure we're supporting our children as best as we can. Parents, I would like to encourage you, if you do have any questions that maybe come to mind after tonight, please do not hesitate to reach out to Ms. Navarra or any of the other resources she's listed. She is here as a support in addition to our other primary social workers in all three buildings, Ms. Gleason, Mr. Cogliano, and Ms. Muscanera. Everyone is here to provide you with support should you need it. I would like to thank the parents that joined us this evening, as well as the members of the staff. It was a great and informative presentation, Ms. Navarra, and I really thank you again for your time and talent. Thank you so much.
Not a problem. Anytime. Thank you, everybody.
Have a great evening, everyone, and thank you again for joining us.